The Coalition of Texans with Disabilities, Raise Your Voice 2022, Community Attendant Wages, recorded June 6, 2022.
I'm Dennis Borrell with the Coalition of Texans with Disabilities. I'm an Anglo male and got a lot of gray going on. Gray on top of my head, gray in my beard, gray in my eyes. I like to point out that's the only thing that was gray before I got old. But wearing a dark blue shirt here. Glad to be here. Thank you all for joining us today. This is a very important, well, in my opinion, our top priority issue for this coming year. And I'm very pleased to say we're going to have some additional help with this year. And I'm going to take this opportunity to introduce our public policy fellow for the issues of community attendant services and dental services. So I'm going to kick it over to Joanne Consiglia, and she'll introduce herself.
Howdy, y'all. My name is Joanne Consiglia. I am tall and lanky. I'm white. I have very short brown hair and large brown eyes. I'm also wearing a red shirt and a black hoodie. I also think it's worth mentioning that I have multiple invisible disabilities. I have a history academically in working in the disability sphere. I originally was going to go into research of the social experience of people with disabilities. I later transitioned into working more on the service side of things, heading a department at the Houston Center for Independent Living Services. And now I'm at CTD doing legislative advocacy, focusing on attendant care and dental benefits, as Dennis said, as well as a little bit of healthcare advocacy as well, like outside of that.
Thanks, Joanne. Glad to have you with us. And I want to thank the St. David's Foundation and the Episcopal Health Foundation who provide us with the grant funding to bring Joanne into our team. And let's face it, folks, we can always talk about how advocacy can be done with a lot of people, but you really do have to have some people that are doing it 40 hours a week, every week, so we can coordinate all your wonderful self-advocates who are going to push us over the top on this and other issues. So our topic today, the community attendant workforce. This has been our priority issue for some time. Why is that? Number one, there are significant numbers of people with disabilities in Texas who rely on Medicaid community care in order to have a self-directed life, in order to live independently, in order to maintain their health, and to do all the things that we like to do in our lives. Whether it's to hang out with family, get a job, as we have Medicaid beneficiaries working here who use community attendant care, or maybe it's to go to church, be part of the faith community. I know that's important to a lot of folks too. Maybe to volunteer, maybe just to hang out, go have a cup of coffee with a friend, or go to the local diner and have a cheeseburger. That is what makes life. But you know what? You can't do any of those things unless you have reliable community attendant care. So did things get better in the last few years in COVID? Well, it didn't get better for anybody, but it got significantly worse. The COVID pandemic has made stuff worse for the community attendant workforce. And we're seeing that in what we're calling the collapse of the community attendant workforce now. I'm going to share a screen with you here. We are releasing a report today called Crushing the Workforce 2.0. We first did this 5 years ago. We published our first Crushing the Workforce, in which we predicted that the workforce for community attendants was in terrible shape and was only going to get worse. I'm sad to say that those predictions have come true, except our predictions fell short of how bad it's become. And yes, part of that was the pandemic. Part of it is true that the community attendants did not get extra pay, did not get hand sanitizers or PPE, personal protective equipment, issued to them. They didn't get any hazard pay as other direct care providers did that worked in hospitals or congregate settings. they were kind of left out in the, if you will, the wild, wild west. But yet, what did we find out in that pandemic? We found out that one of the most important public health strategies during the pandemic was to keep people who are at high risk at home, not in congregate settings. Keep them as healthy as possible so they don't have to go to a hospital or emergency room because of a decline in health, where they would be exposed to people with COVID and suffer some pretty dire consequences. And then what happened when as society began to reopen? Well, an interesting phenomena, it was predictable, but it's been more extreme than many expected. Market wages for competing jobs have just skyrocketed. And you know what I'm talking about. If you get around the communities you're in, whether it's places you see that you think of as, well, that's where high school students get their first jobs, or that's where somebody can deliver pizzas, or that's where, you know, somebody can, start an entry-level retail job or become a dishwasher at the restaurant, or in my case, man the taco stand around the corner from my house. And what do you see? There's those market wages. You're seeing $17, $18, $20 to deliver pizzas. Yet in Medicaid, it doesn't respond to the market situation. And it responds only to the appropriations set by our legislature. So keep this in mind, appropriations set by our legislators. They have done virtually nothing in the last 10 to 12 years to increase those wages. And, maybe 12 years ago, the current base wage is $8.11 in most programs. When I say most programs, I mean like the Star Plus, the community attendance services, the family care, the priority health care, even Star Kids, even class respite workers are all very, very low paid. Okay, a few of the DD waivers are paid more, but most are paid very low. And you know what, 10, 12 years ago, that might have been comparable to your entry-level job at the local fast food joint. But you know what? Not anymore. Not anymore at all. In fact, those jobs are paying so much more, even double what the community attendant will earn. And the community attendant doesn't have any benefits to speak of. Very, very few have any benefits. That means no sick leave. If you have a sick child and have to stay at home, you don't get paid. If you take Christmas off to be with your family, you don't get paid. And of course, no paid vacation, no health plan, no retirement. Is it any wonder that this workforce is being crushed? If you'll see our little diagram here, our little cover of our Crushing the Workforce report, which we will send electronically to all of you later today, a link to get to that. This in 2 panels says it all. Sorry, we don't have any more attendants. And the answer being, but who's going to get me out of bed? The answer is no one. That's the answer, no one. Is that acceptable? No, it's not acceptable. Is it fixable? Yes, it is. What are other forces that are happening at this time? Now, this one here, this is a demographic showing the aging of the Texas population. Okay, it's more and more people, older people in our communities now. Do you know where people who are aging want to age? At home. They want to age in a nursing home or other facility. And the younger people with disabilities are showing the same kind of upward arc. In other words, creating more and more demand for these services. But don't take my word for it. Take the word of the Texas Workforce Commission. That's the state of Texas's jobs agency. They're predicting that we're going to need 95,000 more attendants by 2028. That's 6 years. And those 95,000 attendants, that's on top of filling all the vacancies that exist in the workforce now. And we're seeing vacancy rates reported as high as 30% or more. Meanwhile, the turnover rate is ranging 50 to 100% and more. I spoke with a major home health chain last week, and they reported that the year before their turnover rate exceeded 100%. So how do you do that? Well, that means they had more people working for them, was more than 100% of their total slots. That means there's some people work there all year, but others only lasted 3 or 4 months before they got other jobs. So their turnover rate, the churn, ended up over 100%. You know what happens when you do that? You're spending your Medicaid dollars on recruiting and training new people instead of care. That can be calculated, and that is calculated in crushing the workforce. And here is even more startling. This is what we're doing to our community attendant workforce. This chart is called erosion of wage rates in 2022 US dollars. So people say, well, $8.11 base wage. That's more than it was in the past. But yeah, it's never been really adjusted. Never had a cost of living kind of situation. So what you're seeing here is it's over recent decades, it's actually eroded by, oh my God, like 35% in real purchase costs, 35%, while still having no benefits. Now, see that thing at the end where it's $8.11? Now, your fast food joint would be up here at the top, way over that $14 an hour one. Those market wages have reflected changes. The Medicaid attendant rate has not. So what's our solution to this? And I'm going to turn this over to you, Chase, in just a minute. The solution is simply put, it has to be a money solution. You know, we're tired of the legislative directions or the agency directions say, solve the problem of recruitment and retention, except don't suggest we give anybody a raise. That's what they've been telling us for years. That's one of the reasons why most of the disability advocates resigned from the community task force at HHSCs, because we weren't allowed to recommend that they be paid more. And we knew it was fruitless. And it is fruitless. So what do you think we should be asking for? Well, this is what we're asking for. $15 in year one of the next biennium, 17 in year two, 15 and 17. That's a lot of money. I see my friend Marcia Weir's nodding her head in the background because she deals with trying to recruit and retain attendants. And Kathy over there is nodding her head too, and she knows this too. And Nancy, and you all know this, we deal with this. Even $15 at year one is still not going to reach us to what your average Chick-fil-A person making a chicken sandwich makes on their first day of work. But we think that, believe it or not, that is reasonable. And I don't think any of you suggest otherwise. 17 in year two, because you can't be stagnant. The second piece of advocacy is not just more money, but to build a mechanism that these wages reflect market forces and demographic forces and go up over time. Now, am I just dreaming? You know, is this just a pie in the sky? Well, in past sessions, I would have said those were high targets, but I am feeling more optimistic than I have in a long time. I'm seeing things move. I'm seeing the Speaker of the House identify the community attendant workforce and his interim charges as a major issue. I'm having, frankly, conservative Republican legislators talk to me like this needs to be a need and recognizing that they haven't addressed it for a long time. So will this happen by just goodwill? No, it's going to be hard work. So at this time, I'm going to turn this over to Chase Bearden, who's going to talk about what we have in mind. Chase, take it away.
Hey, thanks, Dennis. First, I wanted to hand it over to Susie. She had asked for a few seconds to speak. So Susie, if you want to go, and then I'll jump in and fill in from there.
Yeah. Sorry, you took me over. I wanted to add a little bit more to what they were saying about the having protective equipment during the pandemic. What that causes is if one of them is exposed and they don't know it, they come to work for you and you get it, and then it just becomes a big mess. And then if they know ahead of time and they think they can catch it, they take days off. And if that's your only attendant, you're stuck. And I was away for 5 days. So maybe we can use this pandemic to get us moving forward.
And I think you're right, Susie. Again, my name is Chase Bearden. My audio description, I'm a white male with a beard that is definitely getting gray, not as gray as Dennis's yet, but getting there. It's the job, unfortunately. But also I have a photo of the front of CTD so that you don't have to see the messy room I'm sitting in behind me. But thank you all again for joining. And I do want to take a second to thank St. David's and Episcopal Healthcare for, you know, the sponsorship that's helped us to gain an extra person on our team. Joanne will be, you know, it's going to be so much easier for us to take on the bigger tasks that we want to do. For the first time, I think, since I've been at CTD for over 15 years, we'll actually have 5 people able full-time working in the Capitol building during a legislative session. You know, I think we've averaged at times no more than 2, trying to cover as many areas as we can, and we've grown. And having that extra help has allowed us to not just expand into other policy areas, but for this session, it's actually going to help us kind of restrict ourselves down a little bit. And Dennis and I and others have talked about this as part of our legislative plan. So we've been working out what is the best route for us in working on a lot of this legislation. Because like Dennis said, this isn't gonna be an easy lift. This is almost $4 billion, not million, $1 billion that we're asking in an appropriation. Even in a good year, getting 1/10 of that is hard for many of our programs. So this is going to be a very big lift. And to do that, we recognize that we're going to have to kind of constrain how many areas we work in. We're going to kind of focus our resources into this. This is something we've worked on since before I joined CTD, and it's a constant battle. And our hope is that if we can take all of the group strength we have, all of the other advocates, and then really donate and drill down our time to focusing on this, we can, as a large group, make it happen. So part of it too is we're not just looking for that appropriation, because if we do that and we get it, that's great. The problem is we don't want in the next session, the session after that, and within the next decade for those, you know, basic wages to freeze again. We've never had a mechanism in place that helped every session for them to be able to say, you know, it's going to tick up with inflation, something like what you'd see any state employee or anyone working getting a 3% type raise or something like that to help move that up so that we don't get stuck there again. So that'll be the other side of what we're working on with this, is trying to find some kind of mechanism to make sure we don't end up doing that. But with all of that being said, how are we going to get there? It's going to be a mix of things. And I think we've identified our biggest targets are going to be starting in the Senate. It seems to always be a bit of the hardest to convince the Senate. So we want to start there, and we really want to get as much support over there as we can from both sides, both parties, from leadership. So that way it can carry over as we move into the House, which tends to be a little bit easier to work through. But at the same time, you never know. One side might be easier the next time. But our plan is starting in the Senate. We also have a Senate Finance hearing coming up next week that we'll be there to testify about. You know, we have plans for action alerts going out for that one specifically. I think it's going to go out tomorrow, and we're going to ask that, you know, if each of you could sign on, and you know, you'll get that email tomorrow and forward that through onto the legislators. But you know, our focus right now in the interim is going to be meeting with as many of the senators as we can on the finance side, and really explaining how attendant care affects the community in the whole, and how it actually saves money and creates a stronger healthcare system for all of us, and actually lowers the cost in the long run. One of the problems a lot of times with any legislature is they tend to look at only in their budget cycles. So for us, it's a 2-year program. We actually want them to look farther out. We want to show them the savings actually do come. But if we keep cutting it too close and not giving enough funds for that, we'll never get any of those savings or any of those quality of life improvements, all of which give you long-term effects and help, you know, with a stable healthcare system. So we're going to work on getting op-eds published within certain districts, trying to get as much earned media as possible to inform the public of why this is actually a smart move. We're working on getting a economic analysis done by a third party to really show the benefits of higher wages, and trying to get us out of this kind of serious situation we're in. Because as we see inflation increase, I can guarantee you we'll keep seeing attendants quit to move into other areas. That it's understandable. If you can't afford your rent, you can't keep doing the job you're doing if you could get paid 2 to 3 times more in another market. So we're going to really work on explaining that through the legislative session. I can't believe I'm saying this, but we're 6 months out from the start of the next session. I feel like we just ended the last one, maybe because we possibly just did. Hopefully we won't have any special sessions this next go around, but right now is the most important time. Decisions are being made. You know, targets of where they want to head is where we're going, and we want to make sure they understand that this isn't something they can just look over and bypass because they have another emergency in some other area. Let's face it, there's a lot of emergencies going on. There have been for every session, and a lot of times our programs get left out when they need to focus on those. So we're going to do our best to really make sure it stays very public and that they understand. And the way to do that is using the media, working with legislators, you know, trying to do not just op-eds, but getting joint op-eds done with legislators. You know, having y'all tell your stories and helping target those. We can work with you on writing those if need be, and helping you get in front of your legislator. We want to try and bring people in this session to really kind of explain those areas and work together all as one big advocacy team on how we can do that. We'll be sharing more of a detailed plan as we go along and as we develop it out. But this is going to be one of our biggest focuses this session. So you will see us maybe scale back on some of the other things we used to do. But I think if ever there was a time to do that, now's the time for us to dive in head first and really, you know, pour all of our resources into making sure the legislature hears us this go around and we don't pass the buck to the next session. And that's going to include having to work with state agencies, getting their LARs, getting those requests put in, making sure that they make that ask. Because let's face it, if the state agency doesn't ask for the money, the legislature most of the time isn't going to look and say, well, don't you think you need more over here? So we have some steps we need to get in place first, but we will be, sending out information to y'all and asking for your help. And we wanted to see where all of y'all stood. I'm going to put up a poll. If you have a chance, we'll leave it up for a while. Feel free to mark it. And it's actually just, if you could participate and help, what areas would you be able to? And that way we can go back and see those. And when we decide to do an op-ed, we'll see that maybe 4 of you decided you'd be willing, we can contact y'all. Or if you just want to do action alerts. So we have that up on the screen right now. And if each of y'all want to type it in there, if you're not able to click on that, you can always just hit the raise your hand button and we can do that. Or we'll send a follow-up email this afternoon or by tomorrow. You can always do it there and send it from there. And with that, I will turn it back over to, I think, Dennis. Is that who I'm supposed to be giving it back to?
Thanks, Chase. This plan, it's not really CTD's plan. This is our collective plan. Frankly, we've been able to chase up some more resources to try to focus more effort on it. But think of this as not CTD's plan, but think of this as all of ours. And we didn't get to this point by saying, well, we're going to make a big push this time without having years and years of advocacy, not just from CTD, but from many others. And, and I see folks like, Kathy and Nancy and Bob have been really in the midst of this. Susie, you've done it. Marcia, you have, Richard Couder, all you guys have, and other folks too. But we're seeing a few other interesting folks. I see my friend Carol Smith is on here. We've worked with her on stuff, but now I'm seeing that her trade association is wanting to get involved, as is PAX Tex, another trade association. Okay, even the Texas Association of Home Care and Hospice. These folks have, up until now, it's been most of the consumer advocates down there trying to make this happen, and with a little bit of support from them. But now it's everybody. So don't think of this as CTD's plan. Think of this as all of our plan.
Following breakout discussions.
Wow. If you all had the same kind of spirited discussions that we had in my breakout, you probably, the time flew by, because it certainly did with us. And I was there with Ron, Andre, and Jesse, and 2 of them were people who are consumers of attendant care, and Jesse's a provider. And Ron is, of course, a very, very well-known advocate as well. And the stuff we talked about is, and Ron was just tying things together. He said, it's not about us just being scared of being left without attendant care we need. That there's a true case to be made that this is smart public policy and actually money-saving, cost-effective public policy. I once had a friend of mine at a foundation tell me that they wanted to start working on public policy because they figured they couldn't grant their way out of the attendant care shortage. Those were wise words, because no foundation is big enough to replace Texas Medicaid. And you know what? The money is there in Medicaid because they're spending it in places like emergency rooms and hospitals and nursing homes and other institutions that could have been avoided. Avoided. So I'm doing the debriefing here. We have a few minutes to go. So if anybody wants to raise their hand, and Mike, Susie, are you raising your hand?
Yeah.
Go for it.
Then in our group, we were talking about the general minimum wage. Did that $15 an hour ever get passed?
Okay, I think I got that. $15 an hour. Actually, it's not even really enough. Is that what you're saying?
No, she wanted to know if it was passed.
No, we're going to work on that in the next legislative
No,
session.
no,
Yeah.
no, no.
No?
For the general public.
Are you talking about the minimum wage for the general public when they
Yeah.
talked about raising it to 15? It
Yeah.
never did pass. No,
No,
it's
that-
still at the
Okay.
what was the rate? It's like,
I think it was 15. I think it was
No.
in the,
it's like 7 something an hour.
oh, now it's 725.
Okay.
725 is the
It's
current federal
725 or
minimum
something like
wage.
that.
Okay.
So Mike Weiss, I think he said that you had some comment you'd like to make.
Well, yes, we really need to figure out how to pay these attendants. And Chase made a comment about emergencies, but I think this is a emergency, and we need to let them know this. There may be other emergencies, yes, but this is a big emergency in my opinion, because I'm lucky I have a attendant that's been with me 10 years. She's my neighbor, and she's an angel. And I just know one day she'll come and say, Mike, I'm sorry, I need to leave you and go somewhere where I can make more money. And that will be the day I die. Because
Wow.
if she ever leaves me, I don't know what I would do.
Mike, you're
write that
exactly
email.
right. It's an emergency that's been brewing for so long. And if they don't take it seriously, it's going to affect a lot of our lives.
Yes, I've been on class since the late 80s. And like somebody said earlier, it has not changed any over the years.
That's very powerful. Thanks, Mike. Please write that email, and that's the day you die. That's powerful. Glenda, you have your hand raised, so I think we have time for Glenda, and Susie has her hand raised. 2 more comments. We promise everyone we get done in an hour. So Glenda, take it away.
Okay, the perspective that I went with, I've been in rehab for a long time, a lot of years. And this, like it's already been alluded to many times, is an ongoing issue. But I think I would write from the perspective of this is an economic benefit to provide living wages for caregivers, attendant care providers, because they can provide care, which may allow, if a recipient can work, then both people are productive in the community. Both people are able to participate, pay taxes, add to the community, those kinds of things. And I told him, I said, no, that's cold, but it's a fact that legislators are probably going to listen to money and economic policy.
Thank you. You know, it's interesting that all of us on this call seem to realize that this is smart economic policy. So if all of us keep talking that way and then talk about the humanitarian angle like that Mike spoke about, Do not think that this is impossible. If we think that, we're defeating ourselves. It is possible, and there's enough buzz out there that's telling me this is the best chance in a decade. Susie, you have the last comment, and then I'll have a little wind up at the end.
Well, I just thank you what Glenda said. But I want to add that we need to get across that our lives, even though we're disabled, are worth putting investment in, because if they invest in us by helping us with attendance, we can invest in society.
Thanks, Susie. Yes, lives are worth investing into, and that's what I hear you saying. This has been an amazing conversation today. It's only the start. And you've been part of Raise Your Voice. Our next one coming up is in 2 weeks, June 20th. The topic will be the waiting list. And I know there's plenty of you interested in that as well. We'll have a guest speaker, Ashley Ford from the ARC of Texas. He's always up to the elbows in trying to figure out these DD waiver wait lists, which by the way, if you put your name on the wait list today, a reputable calculation says at the current rate, it will take you 27 years to get to the top. And that reputable calculation was made by me. So again, we can't, Raise Your Voice is always free to everybody. You can invite, let people know about this, spread it around. But the reason it's free to everybody is we have supporters that are sponsors of this, and those include Shield Healthcare, Gilead Sciences, We Work for Health, Amgen, AstraZeneca, Touch of Class, and our highest sponsors that we appreciate the most. We appreciate them all, but like these guys even better, United Healthcare and Superior Health Plan. Thank you all. See you in a couple weeks. Hopefully, the waiting list is another big issue. You'll be receiving an action alert, an email and an action alert, as well as a link to the full Crushing the Workforce report. And I just want to say again that this is a collaborative effort, okay? And we're all in this together, and that's the only way we'll win this. And you know what? If this is a fight worth doing, and it is one we can win, okay? There are many emergencies in our state today, some really horrible, okay? But we need to also keep in mind that this particular issue is a very long-standing, been a crisis for a long time, and is now at the breaking point. Thank you for your time today, and thank you all for advocating for people with disabilities. Take care.
Thank you all.